Too often, the cost of medical care factors into a person's decision on whether or not they'll go to the doctor, or worse, if they'll seek emergency care. Licking Memorial Health Systems is doing all it can to remove that concern. We have President Rob Montagnes joining me, along with Cindy Webster, who is their Vice President of Financial Services. So welcome to you both.
Good morning, Robin.
Good morning.
Good morning. All right, Rob, let's start with the mission statement. I want to read this of what Licking says. Licking Memorial Health Systems exists to improve the health of the community. So how do you guys go about fulfilling that mission?
Well, I always start by saying the mission statement doesn't say we take care of sick people. That would be a small component. Improving the health of the community requires us to proactively go out in the community, work with a lot of the other constituents in the community, and do things outside the walls of the hospital. However, a big component of that is providing care to our patients regardless of their ability to pay. So whether they have insurance, they're uninsured, they have some governmental insurance, we're there to take care of their medical needs. And then once they go back out in the community, hopefully after they're well, we continue to work with them proactively in the community, so perhaps they won't need to come back to the hospital.
Right, maybe a focus on prevention
Sure.
in a lot of ways. So Cindy, let's talk about the worries of medical care. I feel like no matter who you are and what situation you're in, that's always kind of a concern, right? You know it's going to cost something. So what are you able to really do for those in the community who maybe can't afford or think they can't afford their medical treatment?
Absolutely. You know, we are a nonprofit community healthcare system, and because of that, we do offer medically necessary care to everyone in our community, regardless of their ability to pay. And so we offset that care through financial assistance programs, which is a tremendous community benefit.
That's nice. Okay, so what other benefits do you guys offer to the community? Talk about Rob about how, you know, you guys go out into the community. You're not just saying, come to us, right?
Absolutely. So as you mentioned, our mission is to improve the health of the community, and we do that. We feel that we not only do that within the walls of our facilities, but also through all of those programs that we offer out into the community. So just looking at some of those programs, we have a very active ActiveFit Senior and Youth ActiveFit programs, which really promote healthy lifestyles and healthy living. We also have a very significant 12-lead EKG program where we equip all of the emergency squads within our community with the ability to transmit their EKG findings to us prior to the patient ever coming in the door, so that our ED physicians have a very good view of the cardiac health of that patient before they ever show up. We also are very engaged in the Habitat for Humanity programs within Licking County, and that's not only a financial commitment from the systems, but also our employees volunteer their time to work on those projects. We have a no-cost smoking cessation or tobacco cessation program for Licking County members, and we also have a sports screening program, which is very robust. The student athlete not only does get the sports screening, the physical exam, but also then for age-appropriate students, they do receive the echocardiogram and the EKG, so hopefully we can identify any cardiac issues in a child prior to something happening on a playing field.
And now, when people come to you initially, is that something that usually they aren't aware of all the ways you can help them financially? I feel like it might just be that, not knowing that there are all these different ways that you guys can help them be able to afford and take that strain away.
Yeah, I absolutely think we do a great job at communicating that within our community. Again, you know, those programs are all at no cost for the community, and so we do what we can to get out there and make these things known throughout our community. So take, for example, the sports physicals. We actually provide that information to all of the schools prior to the screening day so that they're aware that it's happening.
And they can take advantage. That's
Absolutely.
The whole point. All right, and as Cindy mentioned, Rob, LMHS is a not-for-profit healthcare system. So how does that compare to some of the other organizations, and what does that mean essentially for your patients?
Well, I think the most important thing it means is anything we do really is in the best interest of the patients and community. We don't, as administrators or the physicians on the medical staff, don't benefit from those programs individually. We only benefit because our community is better off for having provided that program. And so I think a not-for-profit health system is so critical, especially in a community setting. And certainly I would tell you the majority of hospitals throughout the state of Ohio are not-for-profits and do an outstanding job with their communities. But I do think we take that extra step, and some of the programs Cindy alluded to do go beyond your typical clinical programs, but really get into things like nutrition, obesity, smoking cessation, things that are a little more beyond the typical scope of community hospitals.
Yeah, definitely. Overall health and wellness
Sure.
is what you search for. Good to know it's at Licking Memorial Health System. Of course, you can go to their website, give them a call if you have any questions ever or want to know more about those programs. So thank you both for being here.
Thank you.
Thank you.